The first sort of experiences I had were, the only way I can put it was I used to feel like I was at home when I was at school, and when I was at school I used to feel like I was at home. And then there was occasions after that maybe where I'd dropped things and done funny things and not realised what they were, and had to think afterwards, what was that?
She might just stare across at you and get with a very blank look, and her eyes would sort of glaze over. And then very often, although she didn't actually fall to the floor, she could reach out, particularly with her right arm, and maybe pick up whatever was just to hand.
The epilepsy really very badly affected her. She was not able to lead a normal life. She wasn't able to work because of her seizures.
They started in teenage years and were extremely debilitating, and on occasions she would even suffer serious injuries as a consequence of the seizures.
She was ironing, can't believe it when I think about it now, but with her right hand had got the iron, and she did touch the face with the iron, and there was a V-shaped mark with little holes in. She burnt her chin, although that did heal up, but she then put the iron onto her left wrist and caused a major burn right through the skin.
Well, it scared very much so my family, my parents. After that period of time, I was never left ever then. Never left in the bathroom, never left at home, and I obviously never ironed again, ever. And it also made me feel a bit like I was worthless in some respect, because I couldn't then do anything at all. And I think from that moment on, my seizures were worsening anyway. They affected me more generally in my life because I wasn't getting any cure for it. I wasn't even getting any relief from it or any respite from it at all, because they were just carrying on, and in fact they were going worse and worse.
We were always hoping that the medication would have an effect and that the seizures would either stop or they would be diminished in some way, and then over the years it appeared that that was never going to happen. So a lot of the time was spent visiting specialists, trying different medication, and always hoping that things would improve.
And it was then I went to a GP who referred me, said should we try a different specialist in a specialist hospital. He referred me to the Walton, which was just the start of my absolute journey to getting me to where I am now. I saw Dr. Wieshmann, who was very, very patient with me.
She was very motivated to try some treatment, but on the other hand, she was also very apprehensive and worried about the possible side effects of any change in her treatment regime, and also of possible consequences of any surgery.
Until I'd got the confidence eventually and said I'd take it further, to which we did. And then I saw Mr. Paul Eldridge, who was the surgeon. I had discussions with him, and I went through some tests, further tests with him.
When evaluating somebody for epilepsy surgery, we try to find out that the seizures are coming from one source and that we can remove that area of the brain safely. The operation itself is a temporal lobectomy. The temporal lobe is that part of the brain located roughly behind your eye. You have to make an incision in the scalp to expose the bone, to make an aperture in the bone called a craniotomy, therefore to expose the temporal lobe. Once that's done, it's then a matter of closing the bone, closing the incision, and returning the patient to recovery and subsequent convalescence.
Well, she had a surgery now almost 2 years ago, and so far she is doing extremely well. We were able to reduce her medication. She has now no side effects from her medication, and she had no adverse effects from the surgery.
I've now got a job in the field that I've always wanted to do, which is the medical profession, so I'm starting on the ladder of that. And I know it's a relief to my family. My son can relax and my parents can lead their retirement in peace and not worry.
Well, we're still hovering around, but it's completely different because she is really independent and she's been able to make decisions to do things by herself or with other people that she could never have imagined in the past.
So much so that I understand she's now off to climb the Great Wall of China. And for those of you that have ever been there, it is an extremely steep wall and not one that you would remotely contemplate if you suffered from seizures.
I just feel like somebody's put me back to being 15 and given me my life ahead of me now to start to lead, which is what I'm going to do. And carry on and do the things I've always wanted to do. and seizure free, hopefully, forever now, which is just amazing.